your ADHD medication may not be as effective as it was before, because your brain was used to this nice, slow and steady release of dopamine, but now it's getting these big hits. So the medication, which is releasing it slowly, is nowhere near the highs from nicotine. So the brain becomes a bit blunted to the effects of dopamine. So the ADHD medication isn't working as well because the levels of dopamine that it releases is much lower than from inhaling nicotine in the form of vaping.
Welcome to Successful with ADHD. I'm Brooke Schnittman. Let's get started.
Hi, everyone, and welcome back to another episode of Successful with ADHD. Today, I have Dr. Marc Picot, a GP and family physician. He's a health coach. He's also an ex-vaper. Very much looking forward to today's episode on vaping because we know that there's a huge connection with ADHD and vaping. So just a little bit more about Marc. He started a passion project to help people quit vaping after becoming addicted himself during a bout of depression. And since then, turned it into almost a full-time job and founded Vape Escape, a digital service provider for people with vaping addiction, and authored The Last Puff, through which he got the opportunity to appear on my podcast with his PR company, The Book Publicist. So welcome to our show. And I am thrilled to have you because there are so many adults with ADHD that struggle with vaping, with nicotine addiction. So just want to talk to you a little bit about what the connection is for ADHD and vaping particularly.
First of all, people with ADHD have twice an increased risk of taking up nicotine dependency, so either vaping or smoking. It all comes down to the root cause of what causes ADHD, and in particular the chemicals in the brain that impaired as a result of ADHD, and how vaping, or the active substance in vaping, nicotine, affects them. So ADHD itself is an impairment of the dopamine, mainly in the prefrontal cortex, which is the very front bit of your brain that's involved with your ability to plan tasks, focus, maintain your impulse control, and also a chemical called noradrenaline, which is sort of the baby sister of adrenaline. So those two chemicals are the main implicated in ADHD. So as I said, we talk about vaping. It does have lots and lots of chemicals in it, but the only one that actually acts on your brain is nicotine. The main thing that nicotine does is very quickly causes a spike in the dopamine levels in your brain. So if you think about someone with ADHD, your natural dopamine levels are already low,
Lower.
And that's what causes the disorder. So if you vape, then your levels will be brought back up, essentially to baseline or even higher, and that is what causes a temporary relief of symptoms. So by artificially increasing your dopamine levels by inhaling nicotine, you're temporarily short fix solving the problem with the depleted dopamine levels. And the same thing with noradrenaline, because nicotine acts to increase noradrenaline levels as well. That is why people with ADHD may all be attracted to it. Is one is the underlying abnormalities within the chemical in your brain, which it helps to fix. But two, it's the underlying traits that comes with ADHD. So things like impulse control, for example, more likely to take risks or novelty seeking, instant reward. When you take an inhale on a vape, by the time the nicotine gets to your brain and releases dopamine, it's very rapid. We're talking within sort of 20 to 30 seconds. So it's an instant reward and gratification, and inhibition as well. So it's kind of, there's two arms, I would say. So one is the underlying nature of the condition and the chemicals that nicotine in the form of vaping fixes. But two, it's also the traits that people with ADHD have. So it's kind of a bit of a vicious cycle.
So essentially, vaping is a form of self-medicating, especially for people who struggle with dopamine dysregulation and emotional regulation, correct?
Yeah, it's a form of self-medication, but the caveat to that being is that it's self-medication in the short term. So it's essentially like having a broken bone and taking acetaminophen. That's only the short-term fix to help with pain. Now, the broken bone is what you need curing. So that is an analogy for the underlying ADHD. So you have a short-term fix in vaping, but you have a long-term problem in ADHD. Now, if you vape short-term, then yes, it's likely to control a lot of your symptoms that you are having, alleviate any symptoms of restlessness, anxiety, improve focus. Yes, it is likely to do that. But in the longer term, it's likely to cause longer term harm. With ADHD, and if we're talking about medicating, if we're talking about self-medicating, so medications, for example, they give you a very slow baseline level release of dopamine and noradrenaline, whereas vaping will give you nicotine rushes and therefore dopamine and noradrenaline of up and down, up and down, and up and down. So you're not getting that baseline level. So it's really quite big peaks and troughs.
Which then I would say it's like you need to vape more for people who are vaping because of the peaks and the valleys of doing it and not the effects not lasting as long as say like a medicated stimulant like Adderall or Ritalin.
Exactly. What's even worse for someone with ADHD is the valleys on top of your normal ADHD symptoms. So these big valleys are becoming even more difficult to navigate. That's why it can be really very difficult, especially for someone with ADHD, not impossible by far. So it's really important to say that. But because of these big valleys that you get, it mimics ADHD type symptoms. And even someone without ADHD, when they're withdrawing from nicotine dependence, they basically have ADHD-like symptoms.
Sure.
So an increase in restlessness, mood instability, poor focusing and attention, and difficulty in impulse control, because the easiest thing to do is to alleviate your symptoms is to go and get the vape back. It can be quite tricky, but again, not impossible to get through. Yeah, so I should have said at the start, sorry, noradrenaline is norepinephrine. Noradrenaline is a UK, European thing. Norepinephrine is the American thing, so yeah.
Yeah. Okay, so are there, and there's so much more I want to talk about, but are there specific ADHD medications that interact with nicotine or make quitting harder or easier?
There's no direct interactions with nicotine and ADHD medications. So nicotine doesn't speed up your liver enzymes to get rid of ADHD medications quicker, but there is an indirect mechanism upon which nicotine can impair how well your ADHD medication works. And that comes down to, as I said before, that ADHD medications, they give you this baseline level. So it's nice and slow and steady, so your brain gets sort of attuned to it. Whereas when you're getting the big peaks and valleys, the receptors within your brain, I should say, they become desensitized to the effects of nicotine. So they are getting used to the fact that they're getting these big rises in dopamine. So the receptors in your brain that detect dopamine get what we call blunted. So they don't pick up the fact that you've got dopamine as much anymore. Furthermore, your brain, it knows it's getting dopamine from nicotine. So it sort of switches off. The actual, what we call endogenous production, so occurring within the brain, really starts to slow down because it thinks, I don't need to do this because I know I'm going to be getting some nicotine within the next 20 minutes, 30 minutes down.
So does the dopamine baseline go down?
Your natural brain production of dopamine baseline will go down. Yeah. So what does that mean for ADHD medication? So although there's not a direct link, the highs that they get, the medication gets to, is nowhere near the highs from nicotine. So the brain, as I said, almost becomes a bit blunted to the effects of dopamine. So the ADHD medication isn't working as well. So that's one indirect mechanism. And then the second one is the fact that the natural brain starts to turn itself off from producing dopamine itself. It can make your ADHD medication less effective,
Gotcha.
but not from a direct result of the pharmacological interaction between the two.
Okay. Curious, from your experience, you mentioned you're an ex-vaper. What emotional or mental triggers kept you hooked the longest?
What led me to it in the first place was the depression. So when I was trying to withdraw from vaping, I have a predisposition to depression within my family and personally. The depression was one of the main symptoms when I was withdrawing from it. It's what scared me the most in terms of, I'm having a relapse. I need to start vaping immediately. I was so scared of that feeling that I knew so well that I needed to relieve it almost instantly. So that was one of the biggest draws. So for me, it wasn't necessarily about the cravings that a lot of people get to have it. It was more so the withdrawal symptoms, which can be managed by different mechanisms, different treatments, whether it's weaning from the nicotine strength that you're using. You switch to a juice and you slowly wean the strength down to reduce the chance of you getting withdrawal symptoms or lessen them if they occur. But also combining that with your standard mindfulness techniques, CBT techniques, making exercise, support, human contact. So for me, it was the mental health symptoms, namely depression, that kept me hooked.
Yeah. Why don't you tell me a little bit more, if it's okay with you, how you continue to progressively get off of it? I do know some of my clients who are on patches, who are taking the little things in their mouth with nicotine in it. But what is that gradual withdrawal, or is it different for everyone?
It's a personal choice. Ultimately, it always comes down to a personal choice. So I would always give someone the pros and cons of each method, and then they can make their own informed decision how they choose to quit. For some, they like to go cold turkey and just quit because it's a psychological thing. For others, like myself, who had a tricky time or who are particularly fearful of the withdrawal, which is one of the biggest barriers why people actually try and stop, is the weaning. So for people who don't vape, you can get nicotine in little bottles of juice, e-juice it's called, and it comes in with other substances in, but you pour it into a little pod that they're called, and then you can put that into a device. It's called a pre-filled device, and then you vape that strength. They go up in strengths of 3. So it's 3 milligrams per milliliter, then 6, 9, 12, 15, 18, and 20. Now, when you see the disposable vapes, so things like your Juuls, which are vape once, throw away, they're generally 2%, which is the legal limit we used to have in England because we've just banned them actually recently within the last 4 or so months ago now. In the US, I know you can get up to 5%, which is extremely strong. So if you're on these high strengths of nicotine, the trick is to switch, and instead of having just the single use or one of the pre-filled pod, is to get these bottles and start from where you are. So say 2% is exactly the same as 20 milligrams per mil.
Mm-hmm.
And you reduce by, the first step is 2 milligrams, don't ask me why, but you reduce by one step every 2 to 4 weeks, guided by your symptoms, withdrawal symptoms, and your cravings. If your cravings are very well controlled, your withdrawal symptoms are very minimal, you can go a bit quicker. If you're getting bad cravings or you're getting bad withdrawal symptoms, then stay at the same stage for a bit longer. Ideally, try not to go back up. So that's basically what's called the weaning mechanism in a nutshell. Then the patches, over here in the UK, they're not licensed for use for vaping. Without getting too complex, the amount of nicotine that's absorbed from a patch is about 90%, and 10% gets evaporated from the patch. Now, the amount of nicotine that gets absorbed into the body from inhaling is around a third to a half. So there's quite a big difference. So whereas if you're a smoker, it's quite easy to just go into a pharmaceutical store and just get nicotine patches, or from your physician or your doctor, and it says less than 10 cigarettes, put this patch on. It's a bit sort of trial and error. But again, if you start on, say, the strongest patch,
Mm-hmm.
that would be for people who are vaping strong. So 2% or 5% most definitely should start on the strongest patches. Or if you're using juices that are in the middle of the range, so say 9 milligrams per mil, you could go for a middle strength patch, and then the 7 milligrams is the last patch. So there's no evidence, essentially, is what I'm trying to say in a very long-winded way, about nicotine replacement therapy for smoking in terms of what strength patch you should start on, dependent on how much you're vaping and what strength, like there is for cigarettes. Because as I said, it's easy. It's written on the packet. 10 to 20 cigarettes, you start on 14 milligrams, and 20 above, you're on 21. There are other things like gum, for example, or spray up your nose, or spray under the tongue. But they are nicotine replacement therapy for a different reason. So those are for craving control. That isn't for your baseline level of nicotine. That's what's the patches are for. So you should always try to, at least, if you're thinking about nicotine, I would advise using a baseline patch. And then if you're getting bad cravings, then you can reach for a piece of gum or a spray. But if you're using the spray or the gum, you're not getting this steady baseline level of nicotine within your bloodstream, which we want. You're still getting, but to a lesser degree, these ups and downs, and it takes your body more time to adjust, and it makes it more difficult for you. So that's nicotine replacement therapy.
Gotcha.
And then you've got lots of psychological techniques that can be used. So dependent on the symptoms, of course. The ultimate goal is to try and occupy your mind and your hands at the same time. One of the biggest things that people struggle to overcome can be the actual movement of your hands to your mouth. Some people struggle so much that I know people on 0% nicotine, they can't get off of it because they're just attached to the fact that it's like a comfort thing to hold, that they can, it's become an ingrained mechanism within their brain to use.
Sure.
So treating the two at the same time is very important. So treating the cravings using distraction techniques. Again, it's very personalized, but anything from things like sketching or doodling or doing something creative with your hands, fidget balls or spinners. So something that's occupying your mind and your hands at the same time is really, really valuable. Obviously, exercise goes without saying. That's really important for any form of mental health or addiction or withdrawal from substances. And then really trying to focus in on the thoughts that you might be getting about cravings and what to do in that situation. Really remembering your why. So why do you want to quit? And having that at the forefront of your brain all day, every day, having it on a post-it note on the fridge, having it on your phone is so important, because that is your motivator and your driver. So when things are getting difficult, and particularly during times of craving, having that there will remind you and hopefully help you to resist.
Yeah.
So cravings last the maximum 20 minutes, by the way, so between 2 to 20 minutes. So you just got to ride that urge, and then you'll be good until the next one, which might be less, and your confidence will continue to grow, with time as it goes on.
That's great. So with that being said, I love the why piece and having it in front of you, because we know with the ADHD, there's object permanence issues. And if we don't see it in front of us, we're going to forget why we even started in the first place. But also, if it's lasting 2 to 20 minutes and then it gets less, I would imagine something like a pattern interrupt, not to downplay how hard it is to overcome vaping and nicotine addiction, but I would imagine something like that, moving away from the environment where you're getting that feeling, could be helpful in the moment. Is that correct?
Yeah. So something that's a healthier way of getting dopamine. So, for example, I've got a dog. So taking the dog for a walk for 20 minutes, half an hour. Now I'll go and do that in the woods or by the sea, even better in nature. So healthier ways of getting that dopamine when your brain and body is really craving it. So those are really important during those times. And as I said, it depends on person to person, how you do it. There's various different distraction techniques that you can use. Mm-hmm. But just finding something that works for you, finding a healthier dopamine release. You're not going to get that big hit that you did with nicotine, but nor do you want that. And you need to remind yourself that as you go along as well.
So when someone is in their first week without vaping, how do you coach someone through that when their executive function is low and their dopamine levels are lower?
The first 3 to 5 days are the worst, but in particular for the actual physical symptoms. So by physical symptoms, I mean things like you can get quite severe headaches, nausea, digestive, stomach upset, and they can be debilitating, but it can vary from person to person. But it will also be when your cravings are at their highest as well. So those first 3 to 5 days in particular, where the physical symptoms are the worst with cravings, before they start to lessen and tailor off by the end of the first week. So constantly reminding someone that this is your worst week. If you get through this, you are going to find that things get better week by week. Reminding someone that their symptoms, although not dismissing them, may be quite distressing. They are temporary, and trying to frame it in their minds or visualize it, how they feel, how they would behave perhaps once they're not a vapor. Mm-hmm. So giving them sort of positive reinforcement and reminding them that this is the worst week and that it's temporary. There are, of course, ways which you can manage the various physical side effects that they've got with your normal, treatments that you'd have for a headache. But the craving management is the most important, because the first week is when you're most likely to relapse, because that is when you get this sudden rug pull of dopamine from out of your brain. Generally, cravings will be at their most severe during the first week. Okay. So one is that why, that motivator. 2 is craving tools. So what can you do when you get cravings? And for someone with ADHD, and indeed people not without ADHD, because their executive function drops when they're going through withdrawal anyway, is having sort of a pre-prepared list of maybe 5 things that they could try. And when they get a bad craving, they know what to do, and they can read it, and it would remind themselves that it will be temporary, remind themselves of the bigger goal, which is the fact that they want to quit and why they want to quit, and mechanisms on which they can help to relieve that craving. So whether that might be a friend, a family member, a partner, and knowing that you can call them, maybe having 2 or 3, because
accountability.
Yeah, so having accountability to someone, either someone you know or a professional. So having that accountability. So the various methods during craving, there's so many, and it really depends on the individual as to what will work for them, and it can be a bit of trial and error.
Yeah. And what would you say to someone who keeps trying to quit but relapses?
I would say to them, they are in the absolute majority. It is completely normal, and that only the very few people will actually quit on their very first attempt. It's just simple as that. So if someone says, that they keep relapsing, it's usually accompanied by a degree of shame or guilt, or I can't do it, or why can other people do it? So helping to cognitively reframe that and allow them to understand that, actually, me personally, I didn't quit on my first attempt. It took me 4. So, it's completely normal. I often, during that time, remind them of how addictive nicotine is. So, number 1, heroin. Number 2, cocaine. Number 3, nicotine. So that just puts it within a frame that, that I can understand now why it's actually that difficult, because it is so very addictive, and that's why it's on all the packaging. So I would try to reinforce it, first of all, that it's normal.
Yeah.
And then secondly, I think it's really important to look at why they're relapsing, which is the same as what their triggers are. So common triggers are stress. Stress has got to be up there as number 1. So stressful situations to relieve symptoms of anxiety and depression, like myself. Boredom can be one as well. So just not knowing what to do with yourself, or feelings of isolation, loneliness. So whatever it might be, is trying to look at if there is a pattern. If it's not the first time that they've quit, is there a pattern of why they are relapsing? Is it anxiety or depression a common feature here? Because until you address that underlying root cause alongside the vaping in itself, then it's going to be much, much more difficult for them to quit. So I'm a big fan of journaling and writing it down, so it's visible. It's more impactful that way. It helps you to remember. It helps you to identify patterns that you otherwise might not think about within your mind.
So I'd imagine that's probably how coaches and therapists can also help clients with ADHD who are vaping, trying to get very clear on their why and coming up with helpful strategies to alleviate some of the stress, the anxiety, the depression that comes along with the withdrawal and the reasons why you might even start it in the first place.
There are obviously going to be slight differences and nuances between ADHD. Coaches might help with people with ADHD trying to quit vaping versus people without. But just going back to the very start, the withdrawal symptoms of vaping are actually the same as withdrawal as ADHD core symptoms and traits. So there is a lot in common there. So, but there are obviously some differences as well.
And with relapse, I'm curious, like, what mistakes do people make when they're just quitting cold turkey?
I think going in pre-warned is pre-armed, so knowing what you're likely to expect. So I think actually educating yourself about what is likely to happen when you quit, the symptoms that are common or again, to varying degrees, but knowing what to expect. Because once you know what is happening, it's less likely to sort of create that anxiety in itself, because you know that I'm sleeping really badly, or I'm getting sweats at night time, or why am I getting really angry and irritability? Yeah, if you know all these things are normal, if you know that they're all temporary, if you know the timeline, then I think that's really important, that people can then know that they're riding something out. This is not going to be like this forever. This is going to improve week by week by week. Education is really primarily, and in the book that I've written, the first part of it, other than the underlying science behind it, education is like next, and really informing people before they even try to quit. Cold turkey, you're more likely to get more severe withdrawal symptoms, but you're also they're more likely to resolve a bit quicker as well. So again, it's a psychological thing. Some people just want to go cold turkey because they're so tired, and one of the top reasons of wanting to quit vaping is of being like glued to their vape. They feel controlled. Addiction is all about controlled and being controlled by something external, in this case a vape. Other than that, I wouldn't say there's much differences to if someone was on, say, a nicotine patch, or if someone was going through the gradual reduction technique. People should still learn about the CBT type techniques, or the mindfulness aspects of it, or coping strategies. I don't think there's really that big a difference with going cold turkey versus using aids to help you to quit. It's just knowing that they may be, because not everybody gets it, they may be more severe, but again, reinforcing it is just temporary. And having that accountability, but more so support. So support from people around you, so that you're not doing this alone.
So your book, you mentioned, is the name of your book Vape Escape?
No, so Vape Escape is the name of the organization that I run, and the book is called The Last Puff.
So what type of people should go and check out your book? Someone who's actively quitting, someone who's quit already, someone who's thinking about quitting?
All of the above. So obviously, the number one is going to be someone who's quitting, because obviously it's got everything in there. Someone who's thinking of quitting, it's going to move them through the addiction cycle from contemplation to action. Somebody who's already quit, it's of value as well, because it's got things in there about relapse that we've already discussed. So how to prevent relapse in the future. So I think it could be valuable to anyone, and we don't have the data around relapse rates or long-term relapse rates with vaping, but we know from smoking the relapse rates over, say, 5 years, they're so high that it's only about 20 to 30% of people are abstinent. As a rough figure, I wouldn't quote me too much on that one, but the idea is it's so low. So it's about what you can do from stopping yourself returning back to vaping, understanding why you started in the first place, understanding why you quit, understanding how to prevent relapse, and then understanding how can I make my life more fulfilling by natural, healthier dopamine releases than using vaping.
Just one last piece of advice that you would leave for anyone who's listening who might have struggled with vaping in the past, is currently actively vaping and trying to quit. Someone with ADHD who's listening, what would you want to share with them?
I've said it before, but really remind yourself of your why. So what is that driver? As long as you really bring that to the forefront of your mind and visualize it, write it down every day, it will keep you motivated and driven. So I think that would be my number one top tip. Number two is to remind yourself that what you're going through is normal and temporary. So although it can be particularly distressing, it will get better. Once you're through that first week, that is the worst week generally gone. So if you can ride that week out, week by week, you are going to be getting better and better. So that would be number 2. Number 3, what relapse is a learning experience. You learn from it and then you don't repeat it. So for whatever reason it might be that you relapsed the first time. So just saying that relapse is completely normal, but learning from it. It really is about learning and not about shame and guilt. And finally, because obviously your podcast is about ADHD, if you combine 2 professionals, and again, never be afraid or ashamed about turning to professional support. That's what we're here for. Not doing it by yourself and being isolated. So using that professional support that's available to you will just give you the highest chance that you have of succeeding.
Thank you, Mark. And for those people listening who want to get in touch with you, where's the best way for them to find you?
The best way is to visit my website. So that's Vape Escape, which is all one word, .org.uk. If you go on there, just check out my website, and then my email address is in the footer, or we have a contact page and you can get through to me that way as well.
All right. Well, thank you for being here and appreciate your information.
No worries.
Thanks for listening to this episode of Successful with ADHD. I hope it helped you on your journey. And if you need any additional support for you or a loved one with ADHD, feel free to reach out to us at coachingwithbrooke.com and all social media platforms at Coaching with Brooke. And remember, it's Brooke with an E. Thanks again for listening. See you next time.